Welcome back to In Focus. In the mid-1990s, at the height of Kenya's HIV epidemic, infections in certain areas and demographics was at 30%. In 1999, the government declared HIV/AIDS a national disaster and launched an aggressive, comprehensive national strategy aimed at driving down the HIV infection rates. The National AIDS and Sexually Transmitted Infections Control Program, NASCOP, established in 1987 to spearhead the government's interventions on the fight against HIV/AIDS, reports that the HIV prevalence in the country has dropped from 14% a decade ago to around 6.3%. Dr. Nicholas Makori is the director of NASCOP. He says despite the 50% drop, much more needs to be done.
We strongly believe that HIV testing, people knowing the HIV status, is really the entry point to HIV prevention and treatment. And that's why we have aggressive campaigns for making people know the HIV status. We estimate that by last year, half of the population, adult population, have been tested at least once for HIV. Last year alone, we tested 6 million Kenyans. That is basically 25% of the adult population were tested for HIV. We are also expanding our programs for behavior change, so we're looking at the issue of partner reduction. We also address the issue of concurrent multiple partnerships, the issue of abstinence, and the fidelity. So all those issues are being discussed in totality. And of course, we have very aggressive condom use programs.
The government seeks to make services accessible and affordable to all citizens. Professor Anyang' Nyong'o is Kenya's Minister of Medical Services.
What government has done gone about this is to do two things. One, to make available the services of the National Hospital Insurance Fund to those who are in paid employment and some in the informal sector, so that they can have access for inpatient care to either the private or public health providing facilities.
To reach those in rural and remote areas, the government, through the Constituency Development Fund, is supporting the construction of new health facilities.
Since the year 2003, now going to 8 years, through the Constituency Development Fund, MPs have built over 1,000 dispensaries and health centers nationally. In fact, the figure now is about 1,500. Once these physical facilities are developed by CDA funds, the ministry, both the Ministry of Public Health and Sanitation and Ministry of Medical Services, takes them over so that they can be provided with drugs and nurses or clinical officers. That has meant over the last 7 to 10 years that access to healthcare, particularly in the rural areas, has increased tremendously in terms of physical facilities.
The National AIDS and STIs Control Program, NASCOP, says it is expanding its antiretroviral therapy to improve the quality of lives of those infected and also curb transmissions. Special attention is being given to groups that are considered most at risk.
We look at HIV among certain groups. They have HIV prevalence, 4 or 5 times above the national average. For example, these are what we call most at-risk groups. Some of them are men who have sex with men, sex workers, truckers, and fisher folks. It's very clear to us that these groups we cannot really ignore.
NASCOP supports programs that target those groups. John Mathenge, an HIV-positive male sex worker, says he has benefited a lot from NASCOP-supported clinic for sex workers known as SOAP, downtown Nairobi.
So for me as a person, as John, it has helped me so much. Coming to this clinic like this SOAP clinic or going to any other health facility that is friendly to MSM, to me it has really helped me. I was dying of HIV/AIDS. I had so many problems. I was so weak. I could not even open up and say I am a male sex worker and I'm living positive, and that is what. So we decided to become a role model of the other peers. You become a role model, so the other community can also come out open and declare their status and live positively.
Yeah. When did you discover that you were HIV positive?
Actually, I discovered and I've lived with HIV/AIDS almost for 10 years. But the problem is I didn't want to disclose. So, but when I came to this clinic, but I knew I tested positive long time ago. I knew I had sex with a lot of people without using condom. I know maybe so many people have really suffered because of me, but I did not want to come out openly. But when I came now to Nairobi from Mombasa, I went and discussed, came to a Frederick clinic. I saw even the people who are leading the MAPS program, they are very young, people you can share their ideas with and talk, and I got a lot of support, and I knew I was very weak, but now they have raised me up.
Male circumcision, claimed to reduce chances of infection by up to 60%, is being aggressively promoted among communities that do not practice it. Godfrey Oko is a clinical officer at the Kibera Male Circumcision Clinic.
In this clinic, we offer three major services. When a client comes in, we do what we call MC counseling. We counsel him on the circumcision, male circumcision. We give that counseling. We counsel on the HIV, AIDS, and then we do what we call PITC. We test, the client knows his status, and then again we get the client to the theater if he's fit for circumcision, and we do what we call VMMC, voluntary male medical circumcision.
The Kenya National AIDS and Sexually Transmitted Infections Control Program says the country has one of the highest percentages of people on ARV treatments in the world and is determined to expand the program. That's right.
Well, Makori, I have to congratulate you. I think you've done a phenomenal job with these updates on what's going on in Kenya and in Tanzania, which I guess we'll get to on Thursday. But I want to ask you, were you surprised at how much is being done?
Yes, I was thoroughly surprised because for some reason I did not anticipate the strategy to be really that overarching, all-encompassing, and to have achieved such success. So it's impressive what is happening on the ground. They have come to terms with the reality that HIV is here, it is affecting all sectors of society, and they have to attack it vigorously. And there's no energy, nothing is being spared to contain the HIV infection rates.
Now, what about the gentleman you spoke with, the men having sex with men? Is that a growing phenomenon in Kenya, or is that something that is very out of the box?
What they're saying is that there has been denial that actually there are men who are engaging in sexual activity with other men in many African countries. Kenya has decided to acknowledge the existence of those men and even the existence of male prostitutes, or the sex workers as they like to call themselves. And that is one way of literally combating HIV/AIDS by using different groups on the ground.
Well, thank you so much. That has really helped our audience understand what is going on the continent. Yeah.